Hello, this is Dr. N.S. Mani, and today I am going to present you a case of abdominal pain. My email address is shown there. For your attention, this scientific session meant for students and GPs, can be used for public also, and as a reference is taken from scientific articles. The original source is mentioned at the end of this video. A 12-year-old boy presented to the emergency department with acute abdominal pain, colicky, pain right lower quadrant for the last 3 to 4 hours. It is associated with nausea and non-bilious vomiting, non-bloody. There is no diarrhea, constipation, fever, urinary symptoms, trauma, or no past history of similar abdominal pain. On examination, the body temperature is 38.8, heart rate is 146, respiratory rate is 26, and BP is 110/65. He looks tired. His weight is 38.8, which is around 35th percentile. Abdominal examination shows a soft non-distended abdomen, and there is tenderness in the left and right lower quadrant. He has no rebound tenderness, guarding, palpable mass, and organomegaly are absent. Findings on the rest of the physical examination are unremarkable. Initial laboratory evaluation shows hemoglobin 13.6, WBC 18,000, neutrophils 82, lymphocytes 12, and monocytes 6%, eosinophil 1%, platelet count is 2,77,000. His blood values are all normal: serum bilirubin, direct bilirubin, alanine aminotransferase, aspartate aminotransferase, alkaline phosphatase, amylase, and lipase are all normal. And serum electrolyte is normal, and an abnormality worth mentioning is only urinalysis 1 plus blood. And the abdominal radiograph shows non-specific bowel gas pattern. Ultrasonography of the abdomen shows elongated tubular structures with a hypoechoic center in the small intestine, which suggested the diagnosis. And the picture is shown there, and the arrow marks are showing the structure I mentioned just now. Another simple study confirms the diagnosis. Think about it. Write down your diagnosis immediately after hearing this. See, there are various clinical conditions, medical and surgical conditions, which can present as abdominal pain in a child. Most of these are self-limited, benign, and I had to rule out certain dangerous conditions to prevent the morbidity and mortality, such as acute appendicitis. A thorough history and physical examination and the laboratory investigations are essential to make a definite diagnosis, and most of the time this establishes the diagnosis, provided you have got these following conditions in mind. In this patient, initial laboratory evaluation ruled out intestinal obstruction, pancreatitis, liver disease, and acute cholangitis. Immediately an X-ray was taken. The ultrasonography showed roundworms, and it was done mainly to rule out appendicitis also. CT scan is not needed to diagnose appendicitis. And there is a picture of the roundworm under microscope, and the picture on the right side is simply an animation, but sometimes in unhygienic situation these intestinal obstruction due to roundworms can also occur. It's not rare. What's an ascaris infection? It's a worm that lives in the small intestine, and the female worms can be around 12 inches 1 foot, and adult male is a little smaller than the male. it eats whatever you eat. Most of the time there is no symptom. In children it can affect the growth, weight gain, and it can even have abdominal pain if there is a heavy infestation. So periodic deworming is advised. Improve the hygiene of the child. When immature worms migrate through the lungs, a person can have cough and difficulty in breathing. And when there are a large amount of worms, the intestine can get intestinal block. That is called intestinal obstruction. The eggs are found in human feces and it contaminates the soil and it becomes infectious, and the infection occurs when the person swallows the infectious Ascaris eggs. So eating raw vegetables is a little dangerous. Once swallowed, the immature worm called larva hatches, penetrates through the intestine, carried through the bloodstream, goes to the lung, and through the throat it comes through the intestine where it is swallowed. Through the throat it is swallowed and comes to the intestine. Once swallowed, there is the intestine, becomes adult worms. Adult females again start laying eggs, which passes through the feces, and this is the cycle, and the whole thing takes around 2 months. How can I get ascariasis? The children get it because of their poor hand hygiene when they play in soil, or they take contaminated food or water or food taken from outside, prepared from roadside. What do? You have to see your healthcare provider when you doubt a round-up infestation. Consult the doctor and take the deworm drugs. Most of the time they prescribe albendazole, and they will ask stool sample testing, and sometimes you may notice that stool contains worms, or you may cough it out. Don't get alarmed. Worms can be treated, and the worm should be brought to the doctor, and there is no blood test to diagnose Ascaris infection, so don't waste your time and money on blood investigation. And even taking the drug is not dangerous. The treatment is mainly 1 to 3 days medication. The drug usually given is albendazole. 2 or 3 consecutive days of drug is better. And additional stool examination may be done a week or 2 later. Treatment can be repeated after 2 weeks. If I am pregnant, what should I do? A mother can ask. Infection with the Ascaris worms generally not an emergency, and if your health is at risk, the treatment can be postponed till the baby is delivered. How can I prevent infection? Avoid contacting soil. Do not defecate outside. Use diaper which is hygienic. Wash hands with soap and water before handling food. How can I prevent infection? While traveling, please see that hygiene is maintained. Wash, peel and cook raw vegetables and fruits before eating. Without peeling, don't take fruits. Should I be concerned about spreading infection to the rest of my ear? There is no need. It doesn't spread from one person to another. If you have any questions, please ask your consultant. And these are taken from these references: Exit Care Patient Information and Pediatrics in Review. I thank these publishers for providing me these articles. Thank you.